they present this as though they have not just lots of stories about it working, but as though they have scientific evidence for it working. And the way they present that, I think, is very misleading, in the sense that if you just look at this, you say, oh, they have tons of science behind this. Is real, right? They present it, this is real. This isn't just even, stories. This is for you if you really want to know the truth behind it all. It's not even just, oh, your doctors don't want you to know this. This is real science-based stuff, and present it that way. And then when you look into it, it's not there. But they can present it in a way that seems like convincing, because it looks like they've done the homework. They've put on the trappings of evidence without the substance. And so I think that is something that is important as well, because they're not, it goes beyond the who knows, you might as well try it, to the, well, obviously this should work, you should do it, this is what's real.
Yeah. And I totally, actually I agree with you, because when I went through the techniques, so going through their basic of their thing or whatever, and they had their principles, the 3 principles, I was like, okay, that's not really much of anything. But when I went through each one of the techniques, one of them they don't really talk much about, so I can't tell you about it because there's nothing. There might have been a video or something and I didn't watch it. I was like, I'm reading what they have on there. And majority of these techniques are created by the same person. And I think her name is, I'll look, but I'm pretty sure her name is Carol Phillips. And I was like, who the heck is Carol Phillips? And why is it after all these techniques? And it wasn't until I got to about one of the last techniques that had her name. She's a chiropractor. Mm-hmm. And very interesting, but the jiggle, when I was looking at it and I was listening at what they were saying about vibrations and movement and all this stuff, when I was a teenager, I got in a really bad car accident and I went to a chiropractor. And the chiropractor, in order to move and do certain things with my neck and whatever, would use kind of like this big vibrating machine to like massage the area because it was really messed up. Mm-hmm. And I remember this, and so when I seen this jiggle, I actually thought of that, because it's like this big flat surface thing that they would stick on you and like whatever, because, and I later on, that was my teenage years, later on I went to a physical therapist because I got injured at a job. And when I got injured, that's what they did. They would use a type of like massage technique with their actual hands, because they are, therapists that's working with your body with their hands, and they would use other ones depending on where the spot is, to loosen, so you could train that spot to strengthen. Mm-hmm. And to heal. So technically, when I looked at this, I could see where we use this in other situations. When you do get wounded, you go to somebody and they use kind of a jiggle thing. They don't manually jiggle you at the chiropractor. They don't manually jiggle you at the, going to a therapist, like a physical therapist. But they do use certain techniques that they will use for your body that has a type of like movement to release the muscles to do certain things. So I did understand that. And right away I thought, this is a ripoff to what techniques are for when you have an injury. But what really made me kind of scared about this was nobody's thinking about this, because if you're in the natural world, they say that the hospitals treat women like you're sick. The hospital treats you like you're wounded and you're sick and there's something wrong with you, then it's not natural. But the reality is, when I read just that first technique, and it's the jiggle, it's right on their site, they made it like pregnant women are sick and wounded, and you need a spinning babies coach to help you through it, to have your baby the correct way. And I was like, and I don't think anybody realizes that, but deep in it, when I seen that, I seen stuff from being wounded. And I was like, these are things that when I was wounded, this is stuff that was used on my physical body. I can't imagine being pregnant and somebody jiggling me or, or using those same movements. And I don't even think a physical therapist would do those things to a pregnant person, because you are in a way different state. Your body is completely different. Your blood levels, your fluids, your bones, everything is changing. So I seen that as like a complete ripoff, but I also seen it of how people could easily believe what this technique is. So exactly what you're saying. It doesn't have like the evidence to back it, but so many people like, I did it and it worked for me and it was amazing. And you've got all these like testimonies of, because they've been spinning this stuff for many, many years. So they've got to have all these people that it's worked for them, and anybody that didn't work for them, well, just get out of here. But just from that one, that was just the first one that I seen. And then as I kept going through, like the inversion one, I was like, this is a downward dog in yoga. This is a down dog. Like, how can you not see that? These are yoga movements that they're doing, but doing it in a different way, calling it a spinning babies move. Guess what? Nobody in yoga is doing that. When they do prenatal yoga, they do not have you lay on your back. You do not do corpse pose. I'm sorry, but they do not do that. They do not do that. You lay on your side, you put a pillow between your legs, you put a pillow on your head. They are very particular. And they even have you're going to lay on your left side. Like they are very, very funny about prenatal yoga. So when I read that about having women lay on their back for so many minutes to do all these things with their legs and to do whatever, I was like, we don't even do that in yoga. What are you talking about? I was like, yogis won't even do that. So to see that when they're dealing with pregnant women kind of really freaks me out. But I can see where it's believable to somebody on the outside, somebody that doesn't understand and see. Like in yoga, we modify it for a pregnant body because we don't sleep on our backs because you can barely breathe. Like, let's be honest, you can't hardly breathe. The weight of that baby goes up into like your chest, into your ribs, and it's painful and it's horrible. And for those that can, that's great if you can, but I don't know any pregnant woman. I've never met anybody that's slept on their back while they were pregnant. But all these things, I was like, these are a ripoff of something else that makes it believable with no evidence behind it. No doctor is on there, nothing. Like I said, the one's a chiropractor. So I see where they're pushing that thing, but chiropractors don't know anything about pregnancy. They don't know anything about birthing a baby. They don't know, that's not their scope of practice. Chiropractors deals with, I guess, balance in a way, but they really deal with injuries. They deal with when your body gets messed up, they'll help you pop you back into things. And that's where I think the mistake is with the natural world is they go to the chiropractor and they'll fix you and you'll feel better and da da da. Like suddenly the natural world can use things as if you're broken during pregnancy, but it's all normal pregnancy stuff. But the hospital or doctor, it's like complete opposite. Like, no, you know what I mean? Like it's just this weird thing. So that's what I hate about all this stuff. I was looking at it last night. It really bothered me. I'm not gonna lie. It really bothered me because I do yoga and I was like, I didn't do any of that crazy stuff when I was pregnant, because you just don't do them. It's just not part of the stuff. And I feel like we are having these chiropractors going in and making a lot of money off from these pregnant women when you shouldn't be going getting your bones cracked. Your bones they're going to change. You know what I mean? After you have your baby, your bones have to kind of go back. They do this and then they do this. Like, don't go get messed around in there. Like, ooh, that's
well, I like what you said about chiropractors versus doctors, that the big premise of natural childbirth is that doctors see pregnancy as a disease, as something to be fixed, blah, 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 blah. I'd say I think they see every potential for a problem, but they aren't going to say anything's a problem until it actually shows up. But a chiropractor, why are you going to a chiropractor? Well, a chiropractor can either A, help you get better, or B, fix you, but you're not broken, are you? According to natural childbirth. So why are we going to a chiropractor? Well, because you need them, basically. You need them to adjust your pelvis. You need them to do this for you. You need them to do that for you. But if there's nothing wrong with you, why do you need them?
Mhm. It's very interesting what things can be allowed to be in this is natural in body treatment versus this is medicine in a treatment. I think about all the time, like, to keep you from being induced. We don't want you to be induced. So instead, we are going to give you castor oil, which will cause your labor to start. That's not an induction. If it works, you were induced. Like that's like by definition. You know, the difference is Pitocin you can modulate. So this thing that will have the same effect, you hope your optimal outcome is that this will have the same effect as induction, except this counts as induction, that does not. It's very confusing.
Natural childbirth, we are going to help your body do something.
Mm-hmm.
Medicine, we are going to cause, force, intervene, and make your body do something. Even though the outcome, labor, is what the goal is, right? Induction says we want to start labor. And some, for the natural childbirth, it's like, yes, we want labor to begin, but we want it to begin naturally, even if we make you eat 3 pineapples, 2 pounds of dates, and a bottle of castor oil to do it.
Mm-hmm. And it's funny too, because to me, it's actually, so what is your definition of natural? Their definition of natural is this thing occurs close enough to in nature for me to feel comfortable with it. I don't care if a pineapple has been, essentially genetically modified by human agriculture techniques for years. It's close enough to nature that I feel comfortable with it. I understand it. It is much more natural for a person who's about to go into labor to have a whole bunch of Pitocin in their body than it is for them to have 3 pineapples and a pound of dates and a bottle of castor oil. Pitocin is much, much, much more close to the natural state of things than these other things. But the source of the cause feels too clinical, too laboratory based for them to call it, like, to be comfortable with it. That's what I think the difference is. And I just think it's kind of ironic because, like I said, we're going to give you a synthetic version of the exact same thing that's already in your body. We're just going to boost it up versus here's a bunch of things that you absolutely would not have in your body if it were not for what you're trying to do. And our definition of which one of those things is natural, I just think it's interesting.
And I think you actually said it exactly what it is. Like, I don't think, like, it's hard to kind of pinpoint, but you said what it is. Something like a pineapple or eating dates that you can just go to the grocery store and you can eat them anytime seems more natural. So it seems more inviting versus like getting hooked up to something and you're getting medicine and like, and it's that I think that was exactly what it is. It's the way that it's presented is like, you know what I mean?
I think there's also 2 things here that also play into this. One is that you can buy the pineapple yourself, right? You can buy the dates by yourself. And so this idea behind, like, they want you to feel empowered, that is a little bit there, right? You are much more in control of cutting up a pineapple and eating it than you are of getting an IV and having medicine that you maybe don't really understand very well dripped into your body. So I think that is one of them. And then there's another part. There's a fairly sort of well-established, like, psychology of science phobia, right? I've read some really interesting papers that have to do with, like, what are people afraid of in terms of science? And the more you know about certain topics in science, the less frightening people tend to find them. I think we see this all the time, right? Right now, in the time we're living in now, people like the questions, and one of these papers that I read ages ago, but they asked people a series of questions about their science knowledge, and then they assessed their fear of various science things. And one of the questions they asked is, are there genes in a tomato? And this is a question that many lay people get wrong who don't know science. Of course there's genes in a tomato. Of course. It's a living organism. It grows. But people think, no, there's not. It's natural. And so I think that that's just like that psychology of being afraid of these sort of sciencey, unnatural, I don't know how it's made, I don't know what it does, I know these words, but I don't really have like a deep and instinctive understanding of what they mean.
And then there's the friends and family peer pressure.
Yep.
Especially with natural childbirth.